No More Epidemics is a 5-year campaign to bring together civil society, the private sector, and academia to work collaboratively with governments, with multilateral organizations like the World Health Organization and World Bank to ensure that we're all better protected from the threat of epidemics.
Hello everyone, welcome to This Week in Global Health. As you can see, I am not in my house. I'm actually in DC right now, and we have a very special guest with us. Today we have with us Dr. Frank Smith of No More Epidemics campaign. We're really excited to have him, and we also have with us our amazing panel, Chase Perfect, Koslai, Murray, and Yvonne. So we're going to jump right in. Tell us one interesting fact about yourself. Let's start with that.
I'm not sure this is interesting fact. You'll have to ask my mother about that. I'm recently arrived in the United States. Before that, I've been, doing many global campaigns, including at World Vision and other organizations. I'm a sociologist by training, I guess, but whether that's interesting or not would depend highly on your perspective, but I'm not sure if I can do justice to the question.
That's fascinating. So you can see you could be a sociologist and still be part of global health. It's a very interdisciplinary field. So all you sociologists out there, you could definitely be involved in global health. And so to follow on with that, tell us a little bit about the No More Epidemics campaign. What prompted the beginning of it? How you got involved?
Essentially, No More Epidemics is a partnership between the Management Sciences for Health, the International Medical Corps, Save the Children, and the African Field Epidemiology Network. And during the whole debacle around the Ebola crisis, the CEOs of these organizations recognized that here we are again, after SARS, after bird flu, after swine flu. Here we are with Ebola on the back foot, having to respond to an emergency rather than having put the plumbing in, despite the international health regulations having been approved and coming into force in 2007, despite the panel recommendations following the swine flu outbreak. Here we are again, wondering why we were caught on the back foot and caught by surprise. So what these CEOs recognized is that we need to build up the political momentum and the political will to continue ringing the bell between epidemics, so that measures can be put in place to prevent outbreaks from becoming epidemics. It requires resource mobilization. It requires establishing the systems and structures that will enable us to detect disease early and respond, disease surveillance, and respond far more effectively and far earlier. So they decided to set up this global campaign to take that issue forward. The campaign is playing a part in particularly bringing the civil society sector and the business sector to the table to highlight their concerns and call for changes to take place.
No, absolutely, very important part there. In fact, my personal research actually focuses on that as well. How do you coordinate the private sector and public sector, to collaborate, engage, and mobilize resources for handling epidemics? And during epidemics, that's the biggest problem. The funding is not available when you really need it, which is right initially. The funding comes afterwards. By then, it's a little too late. So definitely a great point.
Does No More Epidemics focus mostly on the epidemics that are receiving the most attention right now, or do you have any What are your priority epidemics, or how do you determine that?
Yes, I mean, I think a number of people have asked me that, and in fact, I think that's beside the point. I think what we're seeing at the moment is a number of interventions in the international or global health space that are disease-specific, and I think those are a response to failure rather than an attempt to address the problems, a search for solutions. They're a recognition that health systems are failing and that we're not going to be able to fix this, and that so we might as well just focus on polio, focus on HIV, focus on malaria. I think that with the epidemics issue is that we don't know what the next threat is going to be. Who would have thought Ebola in West Africa, where this was a disease that broke out in Central Africa, Uganda, Zaire, DRC, and the likes? Who would have thought Zika in Brazil? We would be doing a disfavor, if that's a word, to the sector if we tried to identify a specific sets of risks and focused on those, because that would be us trying to fight the last war based on our knowledge now rather than preparing for the next war. So what we need to do is we need to look at the systems that are in place and focus on the systems and our ability to respond fast, whatever the threat, wherever it is. There was other things that we can do on a much more immediate term, and especially around the international health regulations and ensuring that some of the mechanisms of surveillance are far tighter, and our response mechanisms and our international support is far slicker, if you like.
Definitely. And if I may add here, international health regulations are a set of regulations that was signed or taken on by the international community, and the whole point was to prepare so that if there is a public health emergency that should be of international concern, countries should notify the international community as early as possible, and to ensure the economic damage because of the fear as well as the epidemic is limited. So definitely something you should be looking into, and we will put links on more information on that in the show notes.
Just a quick thing on that. The international health regulations, it's funny, I was looking into this as I came into the campaign, and we were doing some research for the launch report, which is available on the No More Epidemics website. The international health regulations come from a 19th century agreements between the European powers in particular to stem the spread of diseases like cholera. There was a recognition even back then within countries that where there was quite a lot of animosity between these countries at different periods in time, that global health is an issue that goes beyond borders. And I think for me this is a fascinating thing. It's one of the only issues that unites us all in a common humanity. It's not like a number of issues like livelihoods or poverty where people over here can help people over there. Here we have to help everyone because we're helping each other. And a number of people, especially in civil society, are kind of concerned about the securitization of health under the global health security agenda. I don't share those concerns. Maybe the ethical motivation for engaging in the issue is different from the right to health sort of constituency or caucus. But I think that the end product, making us all safe, because our vulnerability in any corner of the world means vulnerability for everywhere in the world, for me is a beautiful message that we need to sort of preserve and take forward.
Absolutely, and I'm all for it. I mean, global health security is a word you would be hearing a lot nowadays. Global health security agenda. It's a framework that started by U.S. took the lead in establishing this agenda, and the whole point is to prepare for epidemics, to respond, and to recover as quickly and efficiently as possible. Again, we'll put the links in our show notes.
The security around these epidemics and global health issues, with increasing international travel and the world being so much more connected than it once was, do you think it's practical to prevent outbreaks from crossing borders without significantly restricting people's freedoms of movement? And I'm thinking about this in the context of how during the Ebola crisis there was a lot of calls in the U.S. Congress to prevent travel from other parts of the world where Ebola was currently being dealt with.
Yeah, I mean, global travel is one thing, but international movement of people, both official and sort of legal and unofficial and sort of illegal, if you want to say it in that way, is not going to stop, and is a feature of sort of modern globalized society. It's not something we can stop. It's our new reality. But what I think we can do, we can intervene in outbreaks far earlier. We can identify them and intervene and sort of isolate them if possible, without them sort of scaling up and spinning out of control. There will be situations, and there will be certain disease threats, the flus, for example, and airborne diseases, where we won't be able to spread, to stop the spread of the outbreak. But then there'll be ways of mitigating its impact. Now, I don't think, realistically, you can't stop a disease, even a relatively slow spreading disease like Ebola. When these diseases arrive in countries with very well developed disease surveillance and epidemic preparedness and response systems, the capacity of the system to intervene, isolate, and deal with the threat is greatly enhanced. Therefore, greatly reducing and diminishing the threat of that particular pathogen to the general population. In countries with weak disease surveillance, epidemic and low epidemic preparedness capacity and response capacity, and weak health systems, that capacity doesn't exist. Therefore, the threat is increased not only to the host population in that particular country, but to the global population at large. So, I mean, with disease threats, infectious disease threats, I don't think we can think anymore in terms of the nation state. We need to think in terms of populations and how we mitigate those risks collectively.
Absolutely. And if I may add on here, even with international health regulations, what they talk about is whenever an outbreak happens, even a public health emergency of international concern, you cannot just, have travel restrictions or trade restrictions. You have to wait for the guidance from WHO and act in accordance to guidance with WHO. In fact, it's actually against the regulations if you don't follow that. And just giving the example of Ebola, I mean, last I checked, there were 37 countries that placed travel/trade restrictions without, it being recommended by WHO. So something definitely to watch out for. And as you mentioned, surveillance is key to everything. That's the only way you can nip the epidemic in the bud.
I'd add another thing. One of the dangers when you kind of lock down and you sort of is the stroke, in inverted commas, the unintended consequences. And we saw that in Ebola, the reducing uptake of maternal, newborn and child health services and access to malaria treatment meant that more people probably died of malaria, for example. I mean, we don't have the figures, but a great number, the deaths from secondary causes and other causes can increase dramatically. Likewise, we know that lack of access to livelihoods and unemployment reduces family incomes and kind of has an effect on morbidity and mortality rates in developing countries in particular. So closing down the borders can have a health impact, and we need to consider that as well. It's not just the particular threat of the pathogen, it's how the measures we take will impact on health writ large, and I think we need to be cognizant of that.
A lot of people in the health community, in global health, there might be a sense of frustration, like, well, we were saying that this was needed before, or now that we've seen the flaws, we know how to improve the response to the next one. But there's the frustration of how do we get the type of cooperation or the type of resources necessary to implement the strategies that we know to be effective. Maybe it's a broad question, but what are some of the strategies to implement those strategies? Yeah,
international health regulations were approved in 2007. If they were implemented and they're legally binding, it's an international framework, legal framework, we wouldn't be in the mess we were in with Ebola, certainly. So why did they not move forward if we knew the answers back then? And that's why I think that advocacy and campaigns comes in. Now, what does that mean? What do we do when we say advocacy and campaigns? Given the fact that on these issues, we know the solutions. Well, if you think about an issue like HIV and AIDS, if you think about an issue like climate change, we've known about these issues for years and years. But it's only when campaigners started to say, look, this needs to be, attention needs to be paid to this, and you need to do more for that, and build a groundswell of people from across different sectors. This is not the scientists saying you need scientific solutions. No surprise there that a researcher is going to say, look, we've researched it and we've got a solution to this. If it's not taken up, it's only as effective as its adoption and distribution and take-up. The take-up is going to happen when people that aren't associated with that sector, with that area of specialism, turn around and say, do you know what? That guy over there or that woman over there has come up with a perfectly good solution that could help us all over here, and certainly reduce the risk that we face currently because you're not doing anything of it. So, for that to happen, people need to know what the problem is. If people were aware that more can be done about that to protect us all, and that they have a voice in making this happen. Businesses may say this is a threat to business continuity, and they're risks that we don't want to live with. Trade unions may say this is a threat to our members. We need more to be done on this, and they're starting to on HIV and AIDS in South Africa, where you're from. Around tuberculosis, how that affects the mining community in particular. Once these mass-based organizations come to the table, we see the issue bumping up the political agenda. It's no longer just a preserve of the Ministry of Health to fit into a very busy schedule. It becomes also the preserve of, or a concern for other ministries, and in particular the presidency, and other politicians such as MPs and what have you. More noise is made, and then the more space is created for the political solutions that scientists and others and medical staff do have to be taken forward in practice. So we will bring those constituencies to the table. How will we do that? Well, first of all, we've established the No More Epidemics campaign as a platform. We've started the outreach. We've started to increase our partnerships, and we would invite anybody watching this program and listening to this program to go to the website, sign up to the campaign, and get in touch with us if they want to know what else they can do in their communities or within their workplaces. And then we are starting to engage with governments, with the WHO here in Washington, but also in South Africa, where we are, and a number of countries where we've got a footprint, because the organisations that form part of this campaign do have a footprint in a number of different countries, and we're starting to have that conversation and that discussion.
That's absolutely fantastic. And as Frank mentioned, bringing policy to the agenda of the policymakers and the political leaders is not a linear route. And obviously creating advocacy coalitions like what you're doing with No More Epidemics is one way to go about it. So definitely a great point. And we will have the link to No More Epidemics website in the show notes. Definitely reach out to see how you can help out and how you can pledge support for this campaign.
Your No More Epidemics launch video was great and it's very informative.
Thank you.
So in that video, you mentioned about the potential impact of a deadly influenza virus outbreak that would dwarf the 2008 economic crisis. Could you expand more on this?
Yes. I mean, imagine a scenario like the 1918 flu pandemic that affected, I don't know how many, 1% of the global population. Conservative figures put the death toll at 50 million people. Most of those affected were, people, young adolescents and young adults, if you like. So the economically active segments of the population. If you imagine that nowadays, 1% of the population, so we're nearly 7 billion people. That would be 700 million people. Am I right?
Seven, yeah, I think.
Yeah. So,
Yeah.
anyway, but you would imagine workplaces closing down. Flu virus, a flu pandemic, you would need to take on drastic measures to stop the spread and to respond. You would need to shut down a lot of workplaces and stop travel, for example. That would have a tremendous knock-on effect on the economy, a knock-on effect that would take us years and years to recover from. There's a whole set of questions. Now, we haven't done it, but we use the economic models that were developed by a number of other organizations. Merrill Lynch and Bank of America had a good report. Echo Health Alliance had a good report on that, where they did some economic modeling. The Gates Foundation did some good modeling as well, and they put the figures in the tens of billions. There's different figures floating around depending on how you quantify the impact of the scenario. But regardless, even the most conservative of these models indicate that it would dwarf the impact of the economic crisis.
No, absolutely. In fact, like one of the most recent reports that I came across, the Neglected Diseases Risk Framework report.
England,
yeah. So that talked about that if a pandemic was to hit the world, it would cost the world $60 billion per year.
Yeah.
And an investment of $4.5 billion per year could avert that. So you're looking really at a return on investment of roughly over $200, which is great.
I can just tell that you're really passionate about your work. And do you have any advice for people who aspire to careers like yours in health policy and advocacy?
Well, I think it's important to feel passionate and committed to a cause, whatever cause. We all want to leave the world a better place than when we entered it, and that means we need to have the courage of our own conviction and recognise that our voice means something. So wherever we are and whatever we do, join a campaign, do something about it, write to your elected representatives, make that voice work for change. Now, to come into this sector, a lot of people focus on the technical side of things and focus on the content, if you like, the doing of it. Now, what we're focusing on as campaigners is not the doing, but the getting done. And I think that sometimes is more powerful, because if we get it right, our impact is far greater, because we'll have made changes at the broader level, either within an institution that has a massive global footprint, or within a government, or a province or a region that's going to affect the lives of thousands of people, tens of thousands, millions. Now, to come into this sector, a lot of people you find come into advocacy and campaigning almost by accident, because they're already working in this space as volunteers. They start off as community volunteers, they come off as campaign supporters, and then they join. I joined when I started my campaign career. I started at Amnesty International, working on human rights in East Africa. And I started as a volunteer at Amnesty International, and little by little I got my first 3-month contract, then a 6-month contract, then a sort of more permanent role. As you work, you sort of climb the ladder, get more experience. But do start. Don't let start. Wherever you are, whatever you want to do, pick a cause you're passionate about and start campaigning on it. The rest will fall into place if you persevere long enough.
That's wonderful, advice for younger people. We have a lot of viewers who are young professionals and students, so definitely a great advice for them. To wrap up the interview, I'd also like to ask, are there jobs with MSH or No More Epidemics campaign that people can apply to that you'd like to share?
Yes, certainly. I mean, at MSH, there's a number of jobs. Constantly we're recruiting, and I would recommend you go on our website and look for that. Please, by all means, let them know that you saw the this program and that you're applying. At MSH, we are recruiting 2 positions at the moment. One is advertised, one isn't. So you've got the first insight into that. So one of them is a policy advisor to help us with the substance of the campaign. And I would recommend you anyone interested to send CVs, not to myself personally because my email box is already far too full. But there will be an email for you to submit your CVs and applications in on the website. And then we will be recruiting at some stage a communications advisor for the position. And again, this is to get the message out. So whereas the policy advisor is to, and these 2 positions is interesting, appeal to very different types of characters. One will be the attention to detail researcher that is interested in knowing, what is the difference between, the international health regulations and the global health security agenda, and how will we be able to sort of influence the 2 using these 2 different things, and what is the decision-making process that we need to sort of engage with to push the envelope forward, and what can we ask of that decision-making process at this particular stage of time. So it's a very detailed, specific, and in-depth, if you like, type of job. The other job is the communications job, and this is the broad perspective. This is the passion of the campaign, rather than if the former was the head, this is the heart of the campaign, getting the message out, motivating people, telling people why this is so important, how you can join, inviting people to join, telling the story. And I think what mobilizes people is never the head, it's always the heart. So just the intellectual narrative, if you like, gets people agreeing with you. The passionate narrative gets people to stand up and do something about it. So we need the 2 for this campaign, and we're going to be recruiting these positions. So please look out for them on the website and on the MSH website as well.
Fantastic. Thank you so much for your time, Frank, and thanks a lot to our lovely panel who collected these questions from Twitter and from each other.
Thanks a lot, and thanks for listening.
This is all we have this week, so we'll see you next time. Bye.